It's a great honor for me to open this webinar between Oslo University Hospital and Huashan Hospital, which is part of Fudan Hospital in Shanghai. And this clearly demonstrates the friendship and collaboration between our two countries. I am Arne Brandseter, and I work as an infectious disease physician at the Department of Infectious Diseases and the Norwegian National Unit for CBRNE Medicine. Personally, I was able to benefit from our friendly relationship between our two countries when I was an exchange student in Beijing from 1981 to 1983. 所以我还会讲一点中国话。不知道你们听得懂我讲汉语。但是我们特别荣幸有这个机会和你们见面。This webinar has only been possible due to the initiative and strong support by Elise Chen, who is the Managing Director of the Norwegian Chinese Chamber of Commerce, and Jan Frick at the Southeastern Norway Regional Health Authority. Also, this webinar would not have been possible without the support of the Norwegian Consul General in Shanghai, Kristin Iglum, who extended the official invitation to Dr. Zhang Wenhong. At Oslo University Hospital, we are truly grateful for this opportunity to meet with Professor Zhang Wenhong and that he had found time to share his valuable experience from responding to COVID-19 in China. And we really look forward to hearing his presentation and exchanging experiences. I would also like to acknowledge Dr. Ai Jiangwen, who has been instrumental in providing this technical base for us to communicate today. But before I introduce Professor Zhang, I would first like to give a brief overview of the situation of COVID-19 in Norway and at our hospital. Okay, so Oslo University Hospital is where we are located, is the largest hospital in Norway. It has almost 1,900 beds and around 24,000 employees. And this came into being as a merger of 4 previous hospitals in the Oslo area in 2009. We are today at Ullevål Hospital, where we have a big department of infectious diseases, at least by Norwegian standard. We have two areas for treating patients here. On the left-hand side, you can see the high-level isolation unit. And further down, you will see where the location is for the ordinary bed ward for infectious disease patients. When it comes to COVID-19, we first diagnosed a patient in Norway on the 26th of February. And later that same week, we saw an outbreak at our Department of Ophthalmology, which had an origin in a person who had traveled to the Alps and had got infected there in Italy. And during the following days and weeks, we saw an increasing number of COVID patients in Norway. And in the initial phase, they were all infected in the Alps, either from travel to Italy or Australia. And later on, and during the last weeks, we had seen ongoing transmission in Norway, where it hasn't always been able to trace patients back to these first cases that introduced the contagion from the Alps. So as a result of this, our government imposed very strict measures on the 12th of March. And the aim was to flatten the epidemic curve so that the hospitals would be able to treat the number of patients admitted at any one time. And some of the measures introduced were quarantine of contacts, travel restrictions, closure of schools and universities, closure of certain businesses, restaurants and bars, and work from home has been encouraged for a large part of the population where that is possible. And we in the hospital, we are now allowing no visitors, and also in the nursing home, unless it's absolutely necessary. And we have emphasized the need for people to keep a distance of 2 meters apart, whether it be at hospital or in society. And I think some of the Chinese participants have noticed that we do not wear face masks in the hospital in general. But there is an ongoing debate about this, both wearing face masks in the hospital and out in society, and we may be able to come back to that in the question and answer sessions toward the end of this session. Now, of course, we also emphasize hand hygiene and cough hygiene. So these are just some photographs from the hospital now. This signboard here says that no visitors are allowed into the hospital. We have introduced a triage service for all patients coming into the hospitals. They are being asked if they have been in contact with someone with COVID or if they have symptoms of COVID. And this happens in tents like the ones you see here. And the picture on the top right shows a testing clinic, which was put up primarily for our staff, because we saw that we had a transmission among our staff and, in the hospital, and also from people, some of our staff were infected out in society. So we saw there was a great need to be able to diagnose them in a timely way. And this is from our, bottom left photograph is from our admission ward, where a large part of our patients are being screened. The samples are taken for COVID-19 so that we can rule out the existence of these infections in our patients. And of course, there's been a lot of emphasis and a lot of worry around the correct use of PPE and the supply of PPE. And as you will know, in China, you are a large supplier of this PPE for the whole world. And this has led to a race for this in competition with many others. Unfortunately, in our hospital, and I think also thanks to some of the participants at this meeting, we have been able to secure sufficient amounts for the time being. And this photograph you see here is from a gift that was presented to us from China to the city of Oslo some days ago. And the ambassador of China, Yi Xianliang, was presenting this to our deputy mayor Sten here in Oslo. And of course, for this we are very thankful, and we hope that this meeting today will further strengthen the cooperation between the city of Shanghai and Oslo. So this is what's happened in Norway. I already mentioned that we had our first case in end of February. Then we had a sharp rise in cases, and then restrictions were imposed and advised on the 12th of March. And as you can see from the epidemic curve, we had a later peak, and then ever since we've had a gradual drop in cases. This graph shows the number of patients admitted on any one day during this period. And as you will see from the right-hand side, we have had a steady fall in cases, for which we are, of course, very grateful. This is the total number of patients admitted to hospitals in Norway. And this is the same graph, but showing the patients on mechanical ventilation in intensive care. And as you can see again, that we seem to be in control of the situation at the moment. So I think we can conclude from the Norwegian side that the measures to reduce transmission have worked. And the number of new cases and patients in hospitals are now falling. But the economic cost has been huge to the economy. And many people ask themselves, how do we rightly balance this, the economic cost against the loss of lives? So we try now in a situation in Norway where we're trying to see how we can loosen some of these restrictions. And as an example of this, next week, a kindergarten and the lower 4 grades in primary school will be opening. And of course, we are looking forward, or we are a bit anxious about the effects of these measures, but hopefully that should not put us on a rapid course towards a new peak. But there is a need to resume ordinary activities in the healthcare sector, as in other parts of society. In the hospital, some other patient groups have suffered because COVID-19 has been given all priority. And in general, we hope to be able to gradually return to a more normal life in Norway during the coming weeks. And I think it's really important, and this is a good statement from the Director General of WHO, that the only way we can fight this virus is for all countries to cooperate. It's a time for solidarity, facts, and not fear. And I think this meeting we have here today is also very much in this spirit. And with those words, I would like to introduce our keynote speaker here today, who is Professor Zhang Wenhong. He is professor and head of the Center for Infectious Diseases at Huashan Hospital of Fudan University in Shanghai. He is the leader of Shanghai's anti-COVID-19 clinical expert team. He has extensive experience with the diagnosis and treatment of various emerging infectious diseases. He is a graduate of Shanghai Medical University, but also a visiting scholar and postdoctoral fellow with positions at the Department of Microbiology at the University of Hong Kong, Harvard Medical School, and Illinois State University of Chicago. So Professor Zhang, we are very, very honored to have you here with us today, and we're looking forward to your presentation and our discussion and question and answer session towards the end of the meeting. So our plan is to finish this whole program within about 45 to 60 minutes. After Professor Zhang's presentation, there will be an opportunity for people to ask questions or comments or have an exchange of experiences. For those of you who are not present here in the auditorium, we would like you to post those questions by the chat function of the Zoom. But for people present here in the auditorium, you can perhaps come forward and ask your questions, or I will repeat the questions so that our participants in China will be able to hear. So with those words of introduction, I will close and give the word to Professor Zhang, please.
Okay, Professor Ani, and thank you very much for your presentation, and let me know the situation in Norway. Norway has done a great job for controlling the COVID, and I see the curve of the COVID in Norway now decreased very fastly. So it indicated that the Norway in Europe, actually you have done great job, and I think today I will learn a lot from the Norway for our next wave of the disease. So today I'm here, I just want to share some experience from China, and we can exchange our thought about the disease. So this is curve, we can see it's very similarly like that in Norway, and we found that this curve, this is the confirmed cases in China at a very high peak. I think we can see that in the February 15th and every day in China. So with the new cases around, so we can see here is the highest, and now the confirmed case decreased every day. So today I think that China, we almost have no local, and already we have the local cases. And just like in Shanghai, most of us, the new cases are from imported cases in Shanghai. So today I just want to share some experience today about the China's, our policy for controlling the disease. So actually in China, we have two kinds of the city. One is the epicenter of the disease in China, the Wuhan, and the other cities just like Shanghai. Also Shanghai, we are, as a city is a great city with almost 30 million people live here. And I think it's also it actually is very tough for us to control the disease after importing cases from the Wuhan. So most of the time we will have three styles of our policy. At a very early stage, just like in Shanghai, we just do the job, slow down, and we will lock down Wuhan, and we just have a few cases imported from Wuhan. So what we have done is just do the detection for every suspected cases, and we will trace every close contacts of the suspected case, and then the other people in Shanghai, we just tell them have enough social distancing. It's very lucky for us that during the peak of the disease in China, we just stay at the longest holiday in China, the Spring Festival holiday in China. So therefore, we just stay at home for 2 weeks. I think it's very lucky for us. After 2 weeks, everybody stay at home. I think it's very similar match the incubation period of the disease. After that, we'll restart the city. So, however, after that, we close the schools, we close the restaurant, and only recently we restart the restaurant and we start everything in the city again because we have no cases or almost no cases in the city. So this is what we have done in the very early stage of the disease in Shanghai. And however, I think if in some cities have more patients, I think the slowdown of the city is not enough. We will give the shutdown. Shutdown means so to every detection for the suspected cases, and we elevated the social distancing and including stay at home and stop the transmission of the city, and all the bar recreational site closed. Only the hospitals is open. So this is shutdown of the whole city. So like some cities that have more cases, just like the other provinces, but not Shanghai. So Shanghai, we stay at the very early stage. We control the disease at the very early stage. So we restart our city at the earliest in China. However, even today, we are very concerned about when we restart the city and also open our schools, we're concerned about the cluster cases in the schools. So today we have not opened the school already. So at the end of April, maybe we will restart our schools. So meanwhile, I just want to tell how we control the disease in the epicenter. There's an outbreak of the disease in Wuhan. In total, the Wuhan, we have almost 80,000 cases in the one city. So it's the epicenter of the city and a lot of patients there. And what we have done in that city is a lockdown. We locked down Wuhan at January 23rd, and we stopped the transmission in the city, and we stopped the transmission from Wuhan to other city. So this is the lockdown is very important for us. So just last week at April 8th, we restarted Wuhan because we have really rare cases in Wuhan. So today, I think the whole China restarted already. So what we have done about, we can see there's some strategy we take. The ultimate goal in the COVID pandemic in China, we just do the measures. We do whatever the measures in I think not in whatever the cities. And today I think whatever the countries, we should prevent and stop the overwhelming of the healthcare system. Then we have the chance to save lives. So how to prevent the overwhelming of healthcare system just depend on how much the medical resource you have. So if we take more stricter measures, actually the economic we will have the heavier the burden. So therefore, I think just it will depend on the medical resource in our country. So in China, actually in most city, the ICU beds for per 1 million population, I think maybe not so high. So according to the data in Wuhan city, our government have the decision to lock down the city immediately and have the emergency call for every other cities around China. So here is what we have taken the measures in Shanghai, the epidemic trend in Shanghai. You can see here, this is a first wave in Shanghai. So the lockdown Wuhan here, we stopped the the spread of the cases from Wuhan to Shanghai. Then we take the top level response to the major public health emergency the same day. And so this day is WHO announced the fake. And I think among these days, we slow down the city. We suggested everybody stay at home. And it's happened that it's the longest holiday in China. So from the January 20 to the February 9th, I think. So at this time, so only very rare cases around in Shanghai. I think every day we just have 5 cases, 6 cases, or 4 cases, 1 cases, and I think it's less than 10 cases. If all the cases is less than 10 cases, I think it's very safe. So we resumed our labor and rehabilitation at this day. So the February 10, we restart our city. However, because it's very sensitive for us to find the cases in school. So therefore today, only the school is still closed, but every other organization now is opened. So today we can see here, so we closing the public schools here. So I think we can see here. So even we do not have so many cases, we close the public schools here. So now from February 20th to today, almost 2 months, we still close the school because we have lots of imported cases here. So this is second wave of our city. However, in this second level of the city, actually, we are not so anxious because we find every imported cases and no spread of the case in our community, and no transmission of the case to the other people in our society, and no next generation cases in our city. So even we have lots of imported cases because we take the very strict policy in our city. We give the quarantine for every people entering the Shanghai for 2 weeks, and we do detection for every imported case, for every imported people in our city. So therefore, we can find every confirmed cases in the imported people. So therefore, today, even though we have almost 300 confirmed cases in our city, but we have no spread of the disease in our community. So therefore, in our city recently, we restarted the whole city, and except for opening the schools. And at the end of this month, we will reopen the school. So therefore, all the city now actually restart already. And today, no local cases. So I will discuss about why, what kind of the strategy we take that we can control the epidemic trends in a bigger city, just like the Shanghai. Because according to our colleague in the England, United Kingdom, the Imperial College, they published a paper in Lancet. They indicated that if we no strategy, no measures to taken to control the disease, it will be predicted almost 800,000 will be infected in a city with 30 million people. So if we take some strategy, just like lockdown of Wuhan and shut down the city, almost they will have the 80,000 patients confirmed cases in a city just like Shanghai with 30 million people. However, in the end, our first wave of our city, we only have 400 cases. Now we stay in the period of the second wave of the disease. All the COVID cases now today are imported from other countries. So after our strategies, we control the disease in the first wave, and only several hundred cases happened in our city. So therefore, I think the measures. So we we took in our city, I can give the conclusions. Due to so first of all, I think the most important, of course, it will be the Wuhan lockdown. So after the Wuhan lockdown, actually the population traveling or leaving Shanghai has significantly decreased by approximately 50%. At some very early stage, actually, there's some cases imported from Wuhan to our city. This is all the cases we can find in our city. We close all the large gathering activity at a very early stage. It happens that Shanghai extended the Spring Festival holidays to 17 days because traditionally the Spring Festival holidays, we have 10 days, but today we extended the Spring Festival holidays 17 days from January 24th to until February 9th, and which can cover the period of the incubation of the disease. So I think these measures just have been taken by us to minimize the possible transmission from patients in their incubation period. So then we encourage every people but not forced to stay at home. Actually, during those days, our citizens it is permitted to go outside, to drive their own cars to everywhere at their convenience. However, we will encourage the people stay at home and no gathering activities in the city. And almost the restaurant is closed. However, the market, the hospital, the bank is still open, was still open. So I think during our slowdown duration in our city, necessary working and shopping or medical treatment was not stopped, I think. So this is what a kind of the strategy we take. The lockdown extended the holiday, encourage people stay at home and stop the large gathering activity. However, the most important for us is to find the cases. I think if we lose the lost the cases in the community, it will be very dangerous. Therefore, our strategy is to maximizing the detection. So from the January 24th, actually we do the detection for every suspected we met. All the detection is free here. So once we find the confirmed cases, the CDC staff will do the tracing of the close contacts. They will trace the close contacts. And actually in Shanghai, we have lots of CDC staff in this city to do the tracing. So we will do the maximizing tracing for the disease. So according to my memory, that once time there's almost 1,000 close contacts for one case. So therefore, even though there's a lot of close contacts, we will do the tracing for the close contacts. Then we will quarantine the close contacts and for 2 weeks. If there's symptoms, we will do the detection for the people. And ultimately, we will do the maximizing hospitalizations. We will provide the beds for every confirmed cases in our city. In China, in Shanghai, we have 2 designated hospitals, and we will gather all the confirmed cases together, and we will give the treatment. And the doctors from every hospitals around Shanghai, from other hospitals, we will go to the designated hospital to help the doctors there for treating the patients, the confirmed patients. So according to our experience is that we do the detection as many as we can. We do the tracing as possible as we can. Then we provide hospitalizations for every confirmed cases. Even the patients have no symptoms. Even the patients, the symptom is very mild or just moderate, we have the patients in the hospital. We will not do the family quarantine. because according to our experience in China, we found that the family transmission is very severe, because in China most of the time, just like the family in other Asian countries, the house is not so big, and there's not a so big house, but accommodated so many people together. So sometimes the family have the grandpa together with the grandson. So there's some people in the, I think, in very crowded in China. So therefore, as if we just quarantine the patient at home, I think the family transmission is very, very severe. So at a very early stage, we found that in Wuhan city, the epicenter, 70% of the disease found just was caused by the family transmission. Therefore, provide very enough hospitalization for every patient. I think it's also is very important. So according to our experience, I think we just test all, trace all, and admit all. So in China today, so very similarly every city in China. I just give the example of Shanghai. In Shanghai, we have 117 designated fever clinics. So also we have 182 fever sentinel hospitals, which can provide the detection, provide to find the COVID patients. So all the patients met one epidemiology. If the patients was from Wuhan and plus one clinical criteria, just like the cough or fever, I think we will do the detection for the patients immediately. So if the nucleic acid, the test is positive or admitted into all the patients will be admitted into the designated hospitals. Then the contact tracing done on all confirmed cases to maximizing the tracing for every confirmed cases. So test all, trace all, and admit all is our policy in Shanghai. So here I just wanted to the detection is very important. If we can do more detection, I think we will quarantine less people. So this is very safe. So therefore, I think the overwhelming patients is a disaster. However, I think if we do the overwhelming detection, it will be good. So the higher level of the detection efforts will be needed for us to quarantine less people for quarantine every patients, potential patients if we find. So this is our data from Shanghai. We can find here the incubation period is just 6 days, and the incubation days, just a range is from within 2 weeks. However, the right graph we can see here, this is time from days from symptoms onset to hospitalizations. We found here in our city that the time for the symptom onset to hospitalization only 4 days. So this is the median time. So 4 days, I think, is just a way provide the timely quarantine for every patient that we found. So we give the timely diagnosis, then we can give the timely quarantine and avoid the transmission of the disease in the community. So this is the whole picture of the first wave. We control the disease in Shanghai. All the red bars stand for the imported cases from the epicenter of China. The green bar is the next generation patients found in Shanghai, which is associated with close contacts. So therefore, we can find that there are not so many cases caused by the transmission from the imported case to the community. So therefore, if we give the early control of early control of the local transmission, is very important for us to stop the spread of the disease. So we just provide the timely detection, and we quarantine every close contact we found, and then we stop the spread of the disease in the community. So now here is an example of the city with the outbreak. So we can find that in Wuhan city, there's almost 80,000 cases actually they found in the city. So they, of course, this has lots of patients. Now today I found that in Norway, you just have almost more than 6,000. I think you control the disease very well. However, it is a very early stage in China. Our patients in Wuhan city, there's a lot of patients there. It's a outbreak of the disease. So how to control the disease there? I think the strategy is almost the same. We just provide the overwhelming diagnosis, overwhelming detection for the people. So in the city, lastly, we can provide 20,000 detection every day. So we will do the detection for every suspected cases in the city. So therefore, in the later stage, we found a lot of people. So from a mild to moderate to very severe and critical ill people in this city. Actually, the strategy to control the transmission of disease is the same. But so many people infected with the COVID, actually the beds in the hospital is not enough. So therefore, lastly, we just provide the Fangchang Shield hospitals. My colleague today, as Dr. Sun Feng, today is still here, and he worked in Wuhan in the Fangchang Shield hospitals for almost 2 months. So he can take us lots of experience in Wuhan working in the Fangchang Shield hospitals. So the Fangchang hospital, I think in China, the effect is just give us the chance to quarantine every patient we found. So it's very important. It's a site for quarantine. So because the patient is from mild to moderate, so we just provide some medical care, food, and social activities, and not so severe cases need us to solve. So to solve. So actually, in Fangchang short hospitals, if we found the progression of the disease, most of the time we will send the patient to the ICU beds in the hospitals. So therefore, this is just a place for us. We just provide some ordinary medical care for the patients, and also they will provide the food and social activities for quarantine the patients in the short hospitals. So this is the Fangchang hospitals we provide. We can find here. So this is a graph. There's a different sport. Every sport can stand for one Fangchang Sherry or one Fangchang Shorty hospitals. So most Fangchang hospital, the biggest one is a spot here. We can find that it will have 1,600 cases in one Fangchang hospitals. So because there were 70% of the transmission in Wuhan were within households. So we think we can, despite the social distancing, asymptomatic cases called transmitted disease. So today we discuss all the cases in United States and Europe and Singapore. We found that if there's a lots of the transmission among the community, I think maybe there's a lot of symptomatic cases called transmitted disease. So therefore, Fangchang Shield hospitals, we just can provide the very early quarantine for the patients and completely break the transmission chain in Wuhan. So this execution is very efficient from the central to local government, and all the cities understood the policy, and actually in the last stage, they like to stay at the Fangchang without a risk to transmit the disease to their close family members. So now we will discuss about prognosis. Now today in Shanghai, we just have the 700 cases already here, and we have 7 cases, dead cases. So the mortality is around 1%. But meanwhile, I found that the mortality in Norway is not so high. But in Italy and France, we found that there's a very high mortality. I think it may be associated with the overwhelming of the patients, and they cannot find the ICU beds. So now the main risk in our cohort, we found that the elderly and the patients with the previous underlying disease, just the obesity, diabetes, and the heart disease is actually is highly related with the death of the disease. So just like the other countries, the young people, most of the time, the symptom is not so severe. However, I think they should have more responsibility because all the young are not the patients, are not the people at a high risk. However, they still have a chance of transmitting to others. So today, I think we should also, we can discuss about the some strategy for stop the transmission of the young people to the whole society. So you can see here, this is the COVID mortality rate by age. We found that if the people stay at the age less than 50 years older, we can find that the highest mortality is just 0.4% in the patient with among the 40 to 49 patients the years older. So after 50 years older, we can find the mortality rate increased with the age. So therefore, today we can say that the high risk of the disease is I think is the elderly age, and then it's underlying conditional disease is also is very important associated with the death of the disease. Thereafter, because today is a lot of colleagues in Norway in the biggest hospital, I think still I want to share some experience in the treatment. So our major goal for us is just to prevent the mild COVID patient to severe conversion. I think it's very crucial. If we have a lot of critical ill patients, I think all the doctors will be very busy. If we provide the mechanical invasive ventilations, so it will be very dangerous because the mortality is very high in the patients with critical ill. So once the disease progresses through the critical ill state, if the patient required mechanical ventilation, the prognosis would significantly worsen. So it's very important for us to stop the progression. So treatment, if we take the appropriate treatment, I think it can prevent the mild from progressing to severe critical state, will significantly improve the prognosis. Because today we do not use a lot of steroids in the patients. So there's some side effects of the steroid, there's a fibrosis of the disease, and not so many. So therefore, I think if the patient can live, I think the prognosis will be good. So if we notice the multiple complications of disease, we can observe that in the severe COVID cases, I list all the multiple complications which is associated with severe COVID. You can see the acute respiratory disease syndrome is the most important one as complications. Of course, there are some other complications, just like acute cardiac injury and heart failure, hypoxic encephalopathy. I think it's maybe associated with thrombosis. So still in the later stage of the patients, there's some sepsis, acidosis, and also the acute kidney injury, which is also associated with the severity of the disease. So I think the multiple complications is really associated with the mortality of the patients. So now for about the treatment, I think how to decrease the mortality, I think the oxygen therapy is the most important. Here I listed some parameters of the oxygen treatment. I think it's very important, just like high flow nasal oxygen, will control the tighter volume and keep the pressure, air pressure at a very low level, and the positive and experimentary levels, and the recruitment manual rates is not so valuable. So of course, there are some neuromuscular blockade and the prone positioning inhaled nitrogen oxygen, and there's some other therapy we can provide for the patients. So now I just want to discuss about the antiviral treatment for the patients. In China, we have done a great deal of the clinical trial, including the lopinavir plus the ritonavir, in which drug have been used in anti-HIV treatment. So today, we taken the lopinavir plus ritonavir. We found that the efficacy for the antiviral treatment, so we can see here, there's no significant difference among the treatment within the treatment group and the control group. So therefore, I think lopinavir and ritonavir is not important among our patients. Meanwhile, another very important antiviral treatment is the hydroxychloroquine. First time our French doctors, they published a paper in International Journal of Infectious Disease. They mentioned that the hydroxychloroquine plus azithromycin can work very well, just like the curve here. However, the right side, we can find that these two bars is similarly the same efficacy. Actually, the red one is the treatment group with hydroxychloroquine, and the right one is a control group. Actually, this group is only controlled by myself. So I think, so according to our data and some furthermore data about hydroxychloroquine, we can find that the efficacy is not so promising. So today, I think even the remdesivir, the efficacy is not so confirmed. Therefore, I think up to now, we do not have any drug that we can recommend for antiviral treatment. However, which kind of the treatment is highly associated with the mortality? I think in Wuhan, I can give the example. At a very early stage, the mortality in Wuhan is very high. Among all the total 201 patients in one hospital in Wuhan, 84 patients develop ERDS, so it's very high. So at a later stage, in Wuhan, only very severe patients will stay at home, and very mild and moderate patients will stay in the Fangchang shelter hospitals. So in the ICU of the Wuhan hospitals at a very early stage, we can find that only 6 patients from 84 receive invasive mechanical ventions. So I think if we give the sufficient respiratory support, it's very fundamental. Therefore, in Shanghai, we have, in the first wave of the disease, we have only 17 ARDS patients. However, we provide all the ARDS patients the invasive mechanical ventilate. So we just give enough the oxygen therapy. And lastly, so 6 of them were treated with ECMO. So according to our data, we found that the ECMO still worked very well. Only 2 patients died of the ECMO or other situations. So today, I think our colleague who have done ECMO is very important for our cohort. So according to my experience in ARDS, we can find that if we have the high invasive mechanical ventilator rate, just like Wuhan, 7% versus 100% in Shanghai, we can find the mortality rate is also different. 52% in Wuhan, high mortality versus the 29 in Shanghai. So I think the mortality rate is really associated with the sufficient respiratory support. If we cannot provide sufficient respiratory support and there are overwhelming patients in the hospitals and no ICU beds can be provided, I think it will be very dangerous for patient can will have, sorry, the patient will have no chance to live in the hospital. So furthermore, I think according to our experience, we will control the oxygen saturation at a steady level, maintain the level at 92 to 96%. If we cannot attain the goal, we will upgrade the oxygen therapy. And sometimes we will notice the carbon oxygen 2. If the carbon oxygen 2 cannot be degraded in the COVID patients, sometimes we will provide the ECMO for the patients in very early stage. Therefore, in totally, we have 6 patients accepted the ECMO treatment, and 4 of them discharged in the end and recovered from the disease. So I think the ECMO this time still help us to decrease the mortality of the disease. But most important for us is just to give some treatment for stop the progression of the disease. So therefore, how to monitor the progression of disease? Most of the time we can see here, there's some indicators: D-dimer, ferritin, cardiac troponin, lymphocyte level, IL-6, and LDH. Every kind of the indicator associated with the progression of disease. However, the D-dimer, which is highly associated with the coagulation status of the patient, I think it's very important. So therefore, we will give the anticoagulatory treatment for the patient with very D higher level. So the D high level actually is a D-dimer level. Actually, I think now today it becomes the target for us to start the anticoagulation therapy. So there's another very controversial opinion about the corticosteroid in COVID-19. So according to our previous experience in the SARS and the MERS and all other viral pneumonia, we found that there's some corticosteroid therapy outcomes. There's some comments. So it can delay the clearance of viral RNA from respiratory tract, delay the clearance of viral RNA, complications. There's some complications just like infection, diabetes, and everything. So therefore, this time, the WHO do not recommend using corticosteroids in the COVID-19 patients. However, according to the experience in our clinically, we found that if we can find the patients at a very appropriate time frame, we can still to treat the patients at a very low level, low to moderate dosage of the steroid, and give very limited duration of the treatment. I think we can stop some patients with the quick development of the disease, including the extension of the CT scan of the pulse of the lung, and also high level of the inflammatory cytokines, high level of the CRP, and also the patient has a high fever. As I think in such circumstances, we will give the corticosteroid at the low to moderate dosage. So up to now, we do not monitor the delay of the virus clearance, and also we do not notice that there are some more infection of the side effects in the patients. So today, we still use a low to moderate dosage among 7 days in some people with a faster progression to the critical ill patients. So furthermore, so some colleagues in China, they still use IL-6 antagonist, which can be used as a rheumatology. We know that. So accumulating evidence now in China suggests that a subgroup of the patients with severe COVID-19 might have cytokine storm syndrome. So usually we will detect the cytokines level in the patients. So if the patient have high IL-6 level, so sometimes the patient will be given the potential indicate the patient have the potential indicate for using the IL-6 antagonist. And sometimes we just give the low dosage steroids to treat the patients. I think the efficacy in some sick patient is still very good. So this, I think, I will say that we just want to find the proper time frame. This is still the possible indicate for the COVID disease progression. The proper time frame for, and also it's very important for nasal cannula or mask oxygen inhalation or high flow nasal cannula oxygen therapy, or even we will give the invasive mechanical ventilation and the ECMO sometimes should be determined just by the time frame. The time frame is very important for us to give the decision to using which kind of the treatment. The proper time frame for corticosteroid is also the same. And meanwhile, we will give the very aggressive anticoagulant treatment, or sometimes we will give the other biological antagonists in the patients. Lastly, I will mention the PPE among the healthcare works. Actually, in Shanghai, we send almost 50,000 healthcare works, including doctors, nursing, and works to the Wuhan. And today, the last one from our medical healthcare works have returned to Shanghai. Actually, no one was infected by the COVID during their staying in Wuhan for 2 months. Therefore, the aggressive PPE, I think, is very important. According to my experience, the mask is the most important. Wear a medical protective mask, just like N95, when work with a patient with suspected or confirmed COVID, is very important. Of course, sometimes we will provide the powered air purification respirator, which is a positive pressure respirator when doing tracheal intubation. So if we have a team who are only for doing the tracheal intubation and bronchoscopy, etc., and I think these guys is very dangerous for the infected with COVID. So therefore, we will provide the powered air purifying respirator for the doctors who will do some very specific measures, just like doing tracheal intubation and something like that. Others, I think, with medical resources for PPE, for personal protection, including the medical protective uniform, protective goggles, gloves. I think every kind of the PPE is necessary for us to protect ourselves firstly, then we can save the people. So conclusionally, today I just share some experience from Shanghai and also from China. These are some key points. We will do the detection for every suspected cases at least twice. I think to keep the false negative not so high. We will do the nuclear test and the treatment for the patient with free. All the detection and the treatment are free. All diagnosed patients will be admitted to designated hospitals, and no patients left outside, no patient left at home. So all patients were traced and quarantined, and also the house close contacts, it will be traced by us, and this is our experience. So if epidemic outbreak region with a break transmission as a chain, break the transmission chain, provide the function shield models with overwhelming beds for the patients, I think it's very, very important for us. So this is the only experience is that find the cases as possible as we can, find and accommodate the patients to the hospital as soon as possible. So these two are the major experience of Shanghai. And so therefore, lastly, I will thank you everybody here today for exchanging the experience among China and the Chinese and the Norway doctors here. So I think we can have more exchange in the discussion afterwards. Thank you. Thank you very much.
Okay, thank you, Professor Zhang. How to control this from an epidemic point of view, but also you gave us a lot of interesting details about the medical management of these patients. And I'm sure we could have had a discussion now for several hours after this meeting. Unfortunately, many of our colleagues have to leave the meeting soon, so I think we will have to have perhaps a longer discussion later on, but we will definitely have some questions before we depart. We really appreciate everything you've shared with us, and there are many points where we in Norway reflect, are we doing the right things, where you in China have been doing things different. But I would like to just ask you one question, which is really important for us in the hospital right now. In Norway, we do not really have designated hospitals for these kind of patients. Basically, all hospitals are expected to be able to isolate and treat these patients. And we are in one such hospital. And during the last few weeks, we have shut down a lot of the planned activities in the hospital in order for us to take care of this COVID patient, as I referred to in my introduction. Now we are in a phase where we are trying to come back to some kind of normalcy, to be able to treat ordinary patients again as they deserve to be treated. And I wonder if you have any experience to share with us, how you deal with this sort of situation where, in fact, every patient that comes into our hospital, in a way, is a suspect COVID patient. Even someone who's broken leg, he may have a reason for falling. Perhaps he was not feeling well because he had COVID and then he fell. So we're testing all our patients. And this, of course, is a big clot in the system, one might say, because we have to test these patients, we have to isolate them, and then we can give them the care that they deserve. What is your experience from your hospital? How do you manage in order to triage these patients at the hospital, and without this having too much adverse effect on the ordinary hospitals in the activities? Have you got any advice or any experience you would like to share with us?
Okay. I think so. Now the situations in Norway and China is totally different. So according to our experience in Shanghai, actually we haven't so many local cases, and we have no local cases during the recent several weeks. However, in Wuhan, the epicenter of China, I think we still have some small members of the cases left in the Wuhan. So I think we can take two kinds of strategy. So in the Norway hospital, actually you still have lots of chance to meet the COVID patients during the ordinary outpatient. And the major risk that I think is in your surgeon. So if we do the surgery in your hospital, the hospital acquired infection, I think still is a high risk. So therefore, I think according to our experience, so most of the time, if we have the new patient from other province with a high epidemic region, usually we will do the antibody detection. So if the patient's antibody detection is positive, we will do the PCR detection for the patient. If the PCR detection is negative, I think we still have the patients. We do furthermore the medical performance for the patient. But so I think usually we will do the antibody detection firstly, but sometimes if the patient is highly suspected, we will do the molecular detection, the PCR for the patient. I think today in Norway, I think it's very important. So at a very early stage in Wuhan, if we ignore the asymptomatic patients in your hospital, I think it's still there's a healthcare worker will face a high risk for that. So meanwhile, I think the PPE for the healthcare workers is another very important issue. I think you still, if during your medical service, I think you still need a PPE in somewhere, just like take the surgical cover in the routine, the zone of the hospital, and take the N95 cover in some special circumstances. Oh, this is our experience. Yeah.
Well, thank you very much for that. And again, China is ahead of us, because when it comes to serology, measuring antibodies, we haven't really introduced that yet, but we're hoping to be doing so very soon, and to be learning more about the epidemiology in the country, and also about the serological status of our patients. So we're hoping that this is going to be useful for us in the future. Opening up kindergartens next week, and there are some I guess most reports say that children, they do not really play an important role in the epidemiology of this disease. I must admit, personally, I find that a bit strange. Okay, clearly they do not become severely ill, most of them, but what is your take on whether they actually play a role in the epidemiology in spread in society? What do you think we can expect when we open our kindergarten, and what will you be expecting in China when you open your schools?
Yes, actually in China, we have great concern about when they open the kindergarten and the primary schools, because children there, they usually cannot keep the social distancing. So I think it's very important for us to still have a greater concern for such populations. So I think, I think at your countries recently, you still have several hundred cases every day. I think still we will face a risk. So today I have the discussion with my colleagues in Singapore. So today they have almost 100 cases every day, but they close the schools. I asked the same question for them. When will you reopen the school? They told me that they will reopen the school once there's only less than 10 cases every day. They will reopen the school and the kindergarten. But China, you know that we still have no local cases every day in China, but we still dare not open our schools. So I will open our school at the end of April only for the high level class of the middle school and high middle school for that. So actually, I think in the country with the high epidemiology, I think even the children is not severe. Once they infected the disease, however, I think there's still no risk there. But I think we should avoid the potential transmission of the disease among the school, because maybe there were lots of clusters of the disease. So I suggested you should. I suggest that it's better that we can measure the temperature in the school before they enter in the school, and also will encourage them keep the social distancing in the school, and of course washing hands and everything, and they can and do not have the dinner together. And I think at least we should do something. If we do not do anything, I think the infection will be happen. So actually, I have no more experience for that. I just suggest there's still some risk for that. Yeah.